ILD or Interstitial Lung Disease is a disease of the lung characterized by inflammation and scarring. This means that the normal spongy texture of the lung gets changed or it becomes fibrous and thickened. So the lung is not able to expand during inhalation or go back, recoil during exhalation. This leads to that the blood flowing through the lungs is not able to absorb the oxygen into the lungs, and this leads to hypoxia. The symptoms of ILD usually presented are inability to do routine work, exertional breathlessness, dry unremitting cough, that is the cough is persistent predominantly in the night. The procedures done for evaluation of the same are HRCT. A detailed HRCT done by an experienced technician is very important, and also it needs detailed reporting by a radiologist who's experienced in dealing with such cases. The next test that has to be done is pulmonary function test. This involves an array of tests which include lung volumes, diffusion capacity of the lung to check for hypoxia, arterial blood gases to rule out how much oxygen is present in the blood vessels, and also it involves 6-minute walk test, that is, a person is made to walk for a certain duration in a certain distance to measure his capability. This might also need bronchoscopy at some cases. This is done to rule out any underlying etiology which can be treated. There are more than 100 types of ILD classified. We as a pulmonologist need to take a detailed history and ascertain what kind of cause could be the underlying reason of the disease, which can be smoking, which can be exposure to inorganic dust like silica, asbestos, or organic exposure like pigeon feather, etc. And there might be some autoimmune causes which have to be ruled out.
So you might be wondering why a rheumatologist is speaking about interstitial lung disease. So previously, interstitial lung disease was not known to be an autoimmune disease. Now we know more than up to 30 to 40% of patients with interstitial lung disease suffer from an underlying autoimmune disease. Moreover, depending on the pattern of lung involvement on the CT scan, we may be able to determine whether it is autoimmune or not without you actually having any autoimmune features. But a lot of times we do have features of autoimmune disease, which may include joint pain, Raynaud's phenomena, which is the change in color of your fingers, muscle disease with proximal muscle weakness, or exercise intolerance. You might have a rash associated with this interstitial lung disease. So you might have known autoimmune diseases like systemic sclerosis, rheumatoid arthritis, mixed connective tissue disease, or an inflammatory myositis. More than up to 50% of patients with these diseases actually have interstitial lung disease, and it's important to identify these diseases early because this is the only form of ILD that is easily treatable by medical management, and it's very amenable to treatment before scarring occurs. Diagnosing autoimmune disease is not easy. You might need an antinuclear antibody, an ANA profile, myositis autoantibody profile, and even a nail fold capillaroscope. So the treatment involves IV injections for immunosuppression or oral tablets for non-progression of disease. So this needs a nuanced decision by a multidisciplinary team.
Idea of an ILD clinic is to identify such patients and fast-track their evaluation so that we can come to an early diagnosis on the same day.
A combined ILD clinic ensures nothing gets missed. ILD is a complex disease and early diagnosis changes outcomes.